Bonjour yet again, Chapter 7, Behavioral and Cognitive Behavioral Family Therapies, the Gladding Text, Family Overview, Family Therapy, History, Theory, and Technique. Looking at page 172, behaviorism is an oldest tradition that helping professions, Pavlov and his salivating dogs, Watson and Skinner. Impact of cognitions and thoughts, an approach of cognitive behavioral therapy. Behavioral family therapy, a recent methodology modifying children's actions by parents with using learning theory and reward systems, token economies, reinforcement, positive and negative. Remembering that positive reinforcement, giving something for desired behavior, a reward, reinforces the likelihood that the desired behavior will continue. Negative reinforcement, removing something, a desired reward, for not meeting the desired behavior, increases the likelihood that the desired behavior will continue. Punishment, the aversive, very punitive techniques are reinforce the likelihood that the undesired behaviors will continue versus the other two, negative and positive reinforcement for desired behaviors. Looking at Bandura with social learning theory, modeling new techniques, contingency attention, successive approximation, A for effort, functional family therapy, Alexander and Parsons, Martin and Alexander, CBT, family therapy, fairly new, adapted from Beck and Ellis, Frank Datillo, Schwebel. Major theorists, early pioneers, Watson, Pavlov. Behaviorism gained prominence with B.F. Skinner, first to use the term behavior therapy. Argued convincingly that behaviors can be dealt with directly, not just as symptoms of underlying psychic conflict. He was the originator and proponent of operant conditioning with the reward systems, both negative and positive, to increase desired behaviors. Gerald Patterson, primary rewards, candy, things on very first label, program workbooks for parents, parenting classes. Patterson, McNeil, Hawkins, modeling point systems, timeouts, contingencies. Neil Jacobson, a prominent theorist of behavioral family therapy. Albert Bandura, principles of behavior modification. And Jacobson's findings and insights have challenged marriage and family therapy practitioners to be more innovative and effective in their work. Looking at the premises of the theory. In the simplest form, behavioral family therapy is based on theoretical foundations of general behavioral therapy. Behaviors maintained by consequences and will continue unless there's more rewarding consequences to have new behaviors. A major principle is maladaptive behaviors, not underlying causes, should be the target of change. A third premise, that not everyone in the family has to be treated, that we learn assertiveness, new appropriate functional skills, neither aggressiveness nor passivity, but assertiveness, asking for what wants, desensitization, overcoming unnecessary, debilitating anxiety associated with particular events. Looking at social exchange theory, the rewards and costs of relationships in family life according to behavioral economies. And cognitive behavioral therapy are health-promoting relationship-related cognitions to promote growth in negative relationship-related cognitions leading to distress and conflict. Looking at examples of irrational beliefs, what I must, what I should, what others must and should, what the world must and should, and some catastrophizing and those kinds of things. Looking at parent skills training, behavioral parenting with Bandura, with social modeling, with marriage and couples therapies and education. Don Jackson, looking at Stewart with caring days, taking a positive risk, a unilateral action not dependent on the other person for success. Doing a behavioral analysis of couples' marital distress, establish a positive reciprocity. I statements for communication skills, avoiding labeling and doing training and problem solving, looking at integrative behavioral couple therapy with Cordoba, Jacobson, and Christensen in 1998. Finding acceptance for unresolvable problems, coming to terms with those problems. Looking at page 178 is a caring days agreement. For couples, looking at Ellis with the ABC procedure with REBT therapy, addressing negative cognitions. What is the activating event that caused this irrational thought pattern? What is my belief system? He forgot to get me something from the store, the activating event, belief system. He doesn't love me anymore, consequences. The argument, the fight, the revenge. Looking at cognitive distraction, self-control statements, how to employ rational coping statements using thinking over negative issues, psychoeducational methods, bibliotherapy, relapse prevention, not to fall back in the same negative patterns. Treatment of sexual dysfunction, Masters and Johnson, Piercy and Sprinkle. 4 stages or phases of sexual responsiveness, excitement, plateau, organization, resolution. Looking at the treatment of sexual dysfunctionality, techniques employed, in vivo desensitization. The squeeze technique to stop premature ejaculation by the woman stimulating a firm grasp on the penis to stop premature ejaculation, the teasing, starting and stopping stimulation to overcome performance anxiety, looking at conjoint treatment, looking at combinations of forces, intrapsychic conflicts, guilt, trauma, shame, and a personal conflict in the couple, discord, distrust, anxiety, pressures to please, fear of failure, interactions among extramarital affairs, looking to find the following elements through La Piccolo: the reduction of performance anxiety, sex education, sexual techniques, skills training, communications, and attitude changes. Functional family therapy with Alexander and Parsons. Contact and closeness merging together. Distance and independence separating if we're fighting. A combination to midpoint between the two to clarify relationship dynamics, interrelating thoughts, feelings, and behaviors of family members, interpreting functions of current family behavior, relabeling it to alleviate blame, removal of the behavior and how that will affect the family, and shifting the treatment from one individual to the entire family. Treatment techniques, education, psychoeducation, books, handouts, videos, communication and problem solving, social exchanges, instruction and modeling, positive reinforcement, operant conditioning, mostly in parent-child relationships, contracting, rewards for behaving in certain manners with token economies to keep track of how many times we're meeting the goal. Looking at classical conditioning, the oldest form of behaviorism, a stimulus that's neutral, paired with another event to elicit certain emotions through association. The ringing of the bell with Pavlov's starving dogs, paired with the presentation of meat, resulting in salivation. Coaching. Sally, when you want John to make eye contact with you, gently touch him on his knee. Contingency contracting. Written schedules or contracts. Extinction, a process in which previous reinforcers of an action are withdrawn, ignoring a behavior until the behavior goes away. A contingency contract is on page 183. Positive reinforcement, something that is desired that reinforces desired behaviors. Quid pro quo, something for something. Behavioral marital contracts, agreeing to do something for your spouse. Reciprocity, the likelihood that two people will reinforce each other at approximately equitable rates over time. Behavioral shaping, successive approximation. Like with potty training, if a child runs to the potty but doesn't make it but made the effort, you reward the effort, understanding that successive approximation will lead to the accomplishment of the goal. Systematic desensitization, to reduce anxiety by pairing it with incompatible behavior, muscular or mental relaxation or deep breathing. Page 185 gives targeted behaviors for anxiety. Timeouts when children are isolated, usually 1 minute per age. 30 minutes for a 3-year-old is unacceptable and unreasonable. charting, keeping accurate baseline records of problematic behavior, recording the occurrence of targeted behaviors before the intervention, which is a baseline. The PREMAC principle of behavioral intervention, when the family members must first do less pleasant tasks, get the housework done before we go to the park, before having pleasurable interventions. Disputing irrational thoughts through the ABC format from Ellis with REBT. What is the activating event, the thought or belief system, the consequence, or the emotion? Thought stopping. Sometimes you'll see clients with a rubber band, they'll pop their wrist to remind themselves to stop negative cognitions, repetitive, unhealthy thoughts. Or they will yell stop, or they'll take a journal and write something down very quickly. Self-instructional training, self-management, people instructing themselves. This is Donald Meichenbaum from 1977. Modeling and role-playing, Bandura, social modeling, fake it till you make it, acting as if until it becomes a real behavior. Stress inoculation, again, Meichenbaum. How do we understand, anticipate stress, and figure out prior to the stressor occurring what we will do to deal with that particular issue? The role of the therapist, the expert, the teacher, very directive. The AIM model, anatomy of intervention model. The introduction, the assessment, the motivation, behavior change, and termination. This is Schwebel and Fine, 1992, and Alexander. Cognitive behavioral therapists concentrate on modifying or changing family members' cognitions and interactions. It's extremely active. Process and outcome, how to eliminate and decrease problem behaviors, undesirable behaviors, increasing parental skills, facilitating positive couple communication interaction, improve sexual behaviors, helping families deal with stressors, adult sexual dysfunctions, blending behavioral and cognitive behavioral techniques often occurs. In the unique aspects of behavioral and cognitive behavioral approaches, the emphasis is on learning theory, on approaching the research that is processed from management tools, continuing evolvement that is behavioral for short term, rejects a medical model of pathologizing or diagnosing or labeling, and it has specific benefits for treatment of conduct disorders of childhood and adolescent. Compared with other theories, it does not focus on the affective emotions and behaviors. It is an orientation of learning theory, and uses approaches that are very rigid in their application, lack of spontaneity, consideration of historical data to back up those things, and approach stress, family action over family insight. So what are we going to do, and how are we going to do it? There is a summary and conclusion, as well as a case illustration on page 190, 191, the summary table on 192, and 193. That will conclude us. We will join again, chapter 8. Thank you.